All right, rocket.
So I heard you talking about crowns. What is a crown?
Okay. That one tooth where you have that big silver filling, let me just use a little model here. One of the concerns is that that silver filling actually has mercury in it, which can be a health concern for some, but certainly from a tooth standpoint, we used to use mercury in thermometers for its ability to expand and contract to changes in temperature.
Okay.
Well, that same property is happening inside of your tooth.
Oh.
Your teeth expand and contract to hot and cold, but the silver filling, because of the presence of mercury, expands and contracts greater than the tooth does, and it can actually cause a little crack right in the tooth like that, and that is actually what's happening to your tooth. And so the concern is the size of the filling, the crack that is starting, the lack of strength of the tooth. Really is a weak tooth, and if we try to put a filling in there, it's going to fail pretty quickly, and potentially the one concern is more of the tooth cracks and could crack in such a way that it's now not even restorable.
Okay.
Doesn't happen often, but when you can get in there and prevent that, in a crown, sometimes generically called a cap, because it actually kind of caps the tooth. I'll show you a little example of one here. So this is actually what a crown looks like, and it's made to match your teeth, the color or the shape. Fits according to the adjacent teeth and the opposing teeth and how you bite. Okay, so it all fits in there, and again, the color would be yours, and that is what the tooth underneath would look like. And people see that and they say, well, you're going to make my tooth that small. Well, most of what remains oftentimes is filling, weak structure, new decay, and by the time you take all of that, you really only, sometimes you actually have to build the tooth up to have enough to put a crown on, but oftentimes you're taking very little tooth structure away to make a crown, and then that can prevent fracture and oftentimes allows us to avoid root canal.
Okay. Does it hurt?
No, again,
No.
The way we do it, we numb it, make sure it's numb, go ahead and you should not feel a thing. For it to be a little sensitive afterwards, possibly, but again, very minimal. Anything more than that is a sign that the tooth is having a more significant issue.
Okay.
But again, that is very rare.
Okay.